Kormokar, please do come forward and yes, sir, please do come and take your chair position. Now, I would like to invite our president, Dr. RD Dubey, to give lecture on the topic of metformin. Is it outdated? The session is being sponsored by Blue Water Research Pharma. Dr. Dubey, please.
On behalf of South Calcutta Medical Association, we welcome all of you in this South Calcutta Medical Conference as well as 11th Foundation Day of South Calcutta Medical Association. As you all know, throughout the year we organize different CME programs and some major conferences also, and which are well attended. I hope that today's scientific program will also be liked by you very much, because we have a packed scientific program, highly academic program. And I am starting the ball rolling. And there is a very important topic you might be hearing in CMEs, webinars, as well as articles about this molecule, metformin. Some diabetologists, experts are now saying that metformin is not required for intensive control of blood sugar, which is very much essential. They are saying that from the beginning, blood sugar should be intensively controlled, and for that, newer medicines are more effective, newer medicines are more that should be used in all the diabetic patients. So there is some controversy arising, as well as there are some controversies regarding the side effects of metformin. So briefly, today I am going to highlight some of the advantages, disadvantages, side effects of metformin, and how important this molecule is. So the topic is metformin. Is it outdated? In some of the CMEs, some of the conferences, I have also heard that history of metformin. Let us go back and look about the history of metformin. In Europe, long back, hundreds of years back, there was a herb called Gallica, which was used for certain health problems like urinary tract infection, digestive problems. Accidentally, it was seen that it is lowering the blood sugar also. Then in 1918, scientists discovered an ingredient, guanidine, which was responsible for lowering the blood sugar. Depending upon this ingredient, two medicines were discovered, metformin and fenformin, you all know. Later on, two things happened. One was, there was very severe side effects of fenformin. And secondly, at the same time, insulin was discovered. So a better medicine was available. So these two medicines were discarded and were not further used for the diabetic patients. But again, let us see the mechanism of action, how it works. Insulin is sensitizer. That means metformin, insulin sensitizer, that means metformin increases effects of insulin. As you all know, one of the basic reason of diabetes is insulin insensitivity. So it increases sensitivity of insulin. Metformin suppresses gluconeogenesis and glycogenolysis in the liver. Metformin activates the enzyme called adenosine monophosphate kinase, AMPK. This enzyme is responsible for all its effects. AMPK inhibits enzymes involved in gluconeogenesis and glycogen synthesis in the liver. AMPK stimulates insulin signal and glucose transport in the muscles, which is very, very important, because this glucose is used by the muscles, and for that insulin is essential. So this AMPK stimulates insulin signal and glucose transport in the muscles. AMPK regulates the cellular and organ metabolism, which is very important. Metformin increases the peripheral glucose disposal that arises largely through increased non-oxidative glucose disposal into skeletal muscles. Because of this process, some glucose is created in the peripheral muscles, and that is also neutralized by metformin. And there is very little chance of hypoglycemia with metformin. Is it a wonder drug? What is wonder drug? Wonder drug is a drug which has multiple health benefits. So let us see whether metformin fulfills this criteria or not. Pre-diabetes. You know, people with pre-diabetes have elevated blood sugar that is not yet high enough to qualify as diabetes. Metformin may delay the onset of diabetes or even prevent it among people with pre-diabetes. That means it has been recommended that metformin may be used in the pre-diabetics that will delay the onset of diabetes or even prevent diabetes. Gestational diabetes. You all know pregnant women may develop elevated blood sugar that returns to normal after delivery. But if it goes very high, in that case, we can use metformin that can help us to control blood sugar in pregnant ladies. Polycystic ovarian syndrome. Polycystic ovarian syndrome affects young women whose ovaries develop multiple cysts. This disorder causes menstrual irregularities and fertility problems. Metformin has been prescribed for years for women with PCOS to help with menstrual regulation, fertility, and elevated blood sugar. You all know that metformin is extensively used by gynecologists in the cases of PCOS. Weight gain from antipsychotic medicines. This is also a very important indication. Antipsychotics are powerful medications prescribed for psychiatric diseases such as schizophrenia. One common side effect is significant weight gain. Those who are prescribing this antipsychotic drugs may know that after prolonged intake of antipsychotic drugs, patients develop weight gain, and sometimes it's very, very high. So in that case, metformin may lessen weight gain among some people taking these medicines. Cancer risk. Everybody may not be knowing that metformin lowers the risk of cancer in persons with type 2 diabetes. It has been seen that patients with type 2 diabetes taking metformin for many years, they have lower risk of developing cancer, especially cancers of breast, cervix, colon, and prostate. Dementia and stroke. This is also very, very important. Patients with type 2 diabetes taking metformin for a long time has been seen that there is less cognitive decline and a lower risk of dementia, as well as lower rate of stroke among people with diabetes taking metformin compared with those who are not taking metformin. Aging, very important. Metformin slows aging, prevents age-related diseases, and increases lifespan. This may not be known to many physicians, but this is also very, very important, and it has been proved in many studies all over the world. Preliminary studies suggest that metformin may actually slow aging and increase life expectancy. Metformin improves the body's responsiveness to insulin, has antioxidant effect, and improve health of blood vessels. And you know, health of blood vessels, this is the main reason for many diseases, including cardiovascular disease and stroke. Metformin and SARS-CoV-2. According to a study published in the Lancet, taking a 2-week course of metformin after testing positive for SARS-CoV-2 can reduce the risk of long-term COVID by 40%. It has been published in the Lancet, so it is important. Researchers from the University of Minnesota conducted this study on 1,126 patients. After conducting the study, they came to conclusion that it lowers the long-term COVID. Metformin and HIV. The use of antiretroviral drugs in HIV infections has been associated with glucose intolerance, insulin resistance, hyperinsulinemia, type 2 diabetes, mellitus, low HDL, hypertriglyceridemia, and high risk of CVD. Those who are following HIV patients taking these antiretroviral drugs may be noticing all these effects. So these metabolic alterations are associated with loss of subcutaneous fat and increase the visceral fat. They become cachexic, but there is increase of visceral fat. Antiretroviral therapy with protease inhibitors, especially protease inhibitor, they inhibit glucose transporter 4 mediated glucose transport. They reduce glucose transport, and that leads to higher blood sugar level. Metformin has been shown to reduce visceral adiposity and insulin resistance after 8 weeks of drug therapy at dose of 850 milligram 3 times daily. This visceral fat also a very, very important factor causing many diseases. Versatile profile. The beauty of this metformin is this is being used in fixed dose combinations of all anti-diabetic medicine, whether it's sulfonylurea, DPP-4 inhibitors, SGLT2 inhibitors, thiazolidinediones, alpha glucosidase inhibitors, or even insulin also. This metformin can be used in all these anti-diabetic medicines. And safety profile. The safety profile for metformin is quite good. Mild side effects like nausea, stomach upset, diarrhea, these are common. But serious side effects are severe allergic reaction and lactic acidosis. But serious side effects are very, very rare and occur among people with significant kidney disease. This is very important. Just slight kidney disorder is not contraindication for the metformin, but if it's progressing, then you have to be cautious. Lactic acidosis is rare, but very serious side effect with 50% mortality. It's a very serious side effect. Lactic acidosis usually occurs due to drug overdose or use in some contraindicated conditions. It is more likely to occur in patients with serious infections. These things are important. We must be cautious about using this during serious infections, hepatic failure, kidney failure, recent major surgery, conditions with compromised oxygenation, stroke, congestive heart failure, acute myocardial infarction, heavy alcohol intake, dehydration, X-ray scanning with iodinated contrast, and in patients above 80 years with compromised renal function. So these are the conditions where you must be cautious about using metformin. Why it's not being prescribed? Since its debut, I mean this in America, it was started in 1995. They got the approval of FDA, and since then it's the main medicine being used all over the US. Current guidelines by the American Diabetic Association, metformin should be the first drug for T2DM. There are controversy related to the metformin. In this journal, Therapeutic Advances in Chronic Disease notes that only 65% people, let us see the usage, how much this is being used. Only 65% people with T2DM are prescribed metformin. And it's going down. That is a more surprising and a more worrying thing, that it's going down, use of metformin. As noted in an article in the journal Pharmacy Times, there was a research study to find out why doctors are hesitating to use this metformin. And the concern about the prescribing metformin in the people with kidney disease.
So another 3 minutes.
3-4 reasons. Doctors questions whether metformin deserves its status as the universally recommended first-line drug for T2DM, whether metformin should be prescribed for pre-diabetics. New drugs are more effective and safe. These are the reasons why it's not being used. The same thing, then conclusion. Metformin is this is the home tech message. Metformin is an oral antidiabetic drug for treatment of T2DM. Metformin has several health benefits: decreased hyperinsulinemia, weight reduction, fibrinolysis, improved lipid profile, and endothelial function. Considering metformin's safety profile, benefits, and recent research report regarding nephrotoxicity led researchers to recommend more and more use of the drug in the T2DM and even in pre-diabetics. So this medicine, I mean, if somebody is having high blood sugar, the first thing is lifestyle changes, diet control. And the second thing must be metformin. And after that, depending upon the situation, you may add any other anti-diabetic medicine as per your choice and patient's condition. Only caution I have already told, metformin should be avoided in following conditions: chronic kidney disease, congestive heart failure, liver disease, patients above 80 years with compromised renal function. Even in patients with 80 years with compromised renal function, people use this metformin, and that leads to lactic acidosis, and that causes controversy that whether metformin should be used or not. So one should be cautious about that. Thank you very much for your patient hearing, and we are hearing this sound well. So thank you very much.
Thank you, Dr. Dubey, for your brilliant presentation and talk on the time-tested medicine.